the government of South Africa. Welcome to our first speaker, Dr. Naledi Pandor. Minister Pandor began her career as an educator and since 1994 has had a long tenure of representing South Africa in various government roles. She led South Africa in an overhaul of the education system, and in 2019, Minister Pandor transitioned to her current role as Minister of International Relations and Cooperation. Welcome, Minister Pandor.
Good afternoon, and thank you very much. It's great to be on the program.
Yes, thanks so much for joining us. So I wanted to start with talking about recent news, which has angered a lot of people in South Africa after the emergence of the Omicron variant and South Africa's very helpful role in revealing this to the rest of the world. And it seems to many observers that the response to that discovery and that sharing of information was for the rest of the world to shut its borders to South Africa and then to many other African countries after this variant was discovered. How does your government feel about that? And what would you say to the rest of the world about that policy?
I think you're correct to refer to a sense of anger. I think closely linked to the anger is disappointment, because South Africa has made extensive efforts to ensure responsible addressing of the virus in our country, as well as on the African continent. And of course, we've been extremely vocal about the need for vaccine access equity throughout the world. The reason we found the reaction rather illogical and very, very strange was that we were surprised that world leaders, seemed to have a belief that due to the fact that large proportions of their populations were vaccinated, they were now somehow extremely safe and free of the virus. This, of course, remains something that scientists have constantly reminded us to guard against, that access to the vaccine and being vaccinated does not mean we should stop practicing non-pharmaceutical measures. We need to wear masks, we need to avoid large crowds, maintain social distancing, and so on. So firstly, I believe the reaction was based on a really inadequate understanding of the nature of this virus and how variants and the virus itself behave. I really think that we congratulate South African scientists in being so transparent as to reveal their identification of the presence of the Omicron variant in South Africa. And it is that transparency which then punished our tourism and other economic sectors in South Africa, because the world rushed to ban us. We've called it an apartheid travel ban because it was largely against Black and African countries. But in addition, we were fairly astounded, really horrified, because the WHO has given very clear evidence as to how we need to conduct ourselves in terms of a scientific and clinical response to the advent of the virus. For me and for South Africans, this is really a reaction that is closely linked to the selfishness we have witnessed with the hoarding of vaccines, the lack of support to low and middle income developing countries worldwide. And it just further illustrated the prejudice that exists as our leaders, particularly the global rich countries, respond to this terrible pandemic.
Thank you. And I'm wondering, in South Africa, the percentage of vaccinated people is still quite low. I think in the 40% range. Is that about right?
Yeah.
In your view, what is the issue? Is there something else going on beyond this vaccine apartheid that we've been talking about and the lack of access, is there also a problem with the government's messaging in terms of getting people to take up these vaccines, or are there things that the government perhaps might do to increase access? I've read that a lot of South Africans who live in poor areas aren't able to access vaccine sites so easily. And I was wondering if you could speak a bit about that challenge and what the government is doing to try and get those numbers up.
Well, certainly there is a challenge with respect to reaching the most distant areas of our country, I think the rural areas, but we've had a number of campaigns underway. Government leaders, political leaders, leaders of non-governmental organizations have been very active. We have vaccination weekends where leaders from the top right through society go out encouraging people to come forward and get vaccinated. I think what may be part of the outreach problem is we are not sufficiently using local institutions. So I think now we're talking more about greater involvement of the religious community, the sporting sector. We're even talking about mandatory requirements for persons to be vaccinated when entering public places. But there is a great deal of influence of some political leaders and certain religious groupings that are against vaccination and have used social media very effectively to convey a message of fear to the broader population. That, you know, the vaccination doesn't make you well, you're not immune, and in fact, you can get ill, and some persons who had been vaccinated died, and so on and so forth. So a lot of fear-mongering, which we're having to deal with in public communication. We've discussed the need to ramp up the communication program and to involve personalities in society that enjoy a great deal of public support, personalities in the entertainment and creative arts industries, just to, you know, generate a message that people should come forward. What is interesting is among the 50 and above, you do have quite a significant proportion vaccinated. And it's when we introduced the 18 to 40 that you saw the lower numbers. So younger people who are the users of social media need, I think, much more persuasion and a bigger communication effort. And we're going to be getting that underway.
Thank you. And going back to the issue of access and some of your comments about global pharmaceutical companies, I was wondering if you could comment a bit on the issues around local production in South Africa. There have been some breakthroughs recently in that regard. Was this a major barrier earlier in the pandemic? And what has your government and some of the companies in South Africa done to try to address this in order to achieve a more secure supply domestically?
Well, one of the things that we have said to ourselves as a policy decision is we must never find ourselves in a position where African countries are at the back of a queue waiting for a solution to a very serious health crisis. The fact that we had not devoted sufficient investment in investing in vaccine production is something that has caused us to respond very urgently to enhancing the existing capacity in South Africa. We are fortunate that we do have a good foundation that with investment will be able to ramp up to vaccine production levels. We also are working with other African countries, as well as with international partners, including the United States of America, countries in Europe, to make this happen, because all of us have accepted that the inability to expand vaccine production is a very serious barrier to us successfully addressing this pandemic. our concern is on the continent, less than 10% of the African population that should be vaccinated is vaccinated. South Africa is doing better because we have access, but many poor countries on the continent do not have access to the vaccine. So certainly giving greater attention to research and innovation and building partnerships that help us to be productive is important. Finally, we do believe that regulations around intellectual property access, technology transfer, the management of patents in times of crisis, we think these regulations under the ambit of the WTO need to be relaxed temporarily in order to allow us all to participate in expanded production and to have access.
One question about pharmaceutical companies and deals being made elsewhere. I'm curious how you feel as a member of the South African government watching wealthy nations roll out booster shot programs at the moment when such a large proportion of your own population is still unvaccinated and an even larger proportion of some of your neighboring countries' populations remain largely unvaccinated, just at a time when a new variant is running rampant and many would argue emerged precisely because of low vaccination rates in South Africa and surrounding countries. And so what does that look like from the South African perspective to see what's happening in the US and UK and elsewhere with boosters?
Well, I recall when the WHO declared to the world that we had a global pandemic, world leaders came out in huge numbers making public statements that this was a global problem. And once a solution was found, and they hinted then at the possibility of a vaccine, the vaccine would be a public good for the globe. Lo and behold, when the first vaccine became available, we realized that countries had ordered more than 3 times the number of vaccines that they would need for their populations. And they began to really practice denial of equitable access to the rest of the world, not just to Africa, but even among themselves as neighbors in Europe and elsewhere. So we really need a much more multilateral approach to the resolution of problems that are common to the entire world. I think we would have gone a long way toward preventing the emergence of new variants and continuing episodes of the virus had there been attachment and practical action on the concept of global public good. So I think that the world now, I hope, has learned a lesson that hoarding of a particular treatment when the entire globe is faced by a common problem does not do the world good. All it does, perpetuate the emergence of new variants, perpetuate the need for more closures, and it doesn't assist the world to address a very serious health crisis, which we all need to address working together as the world community. So I am extremely disappointed that this one opportunity for us to show that global collaboration can make a real world difference. We unfortunately have leaders who have failed the test and who failed to come up to the level we needed of cooperation throughout the world.
And finally, what would you say to pharmaceutical companies and governments in Europe and the United States? What more does South Africa need in order to tackle this vaccination problem? And you could also speak for some of your neighboring countries as well. What sort of policy solutions do you think could make a real difference at this advanced stage of the pandemic when so many people thought it was almost over, and now it seems to be erupting in perhaps the biggest wave yet?
Well, I think the first thing I would really recommend we look at is greater sharing and cooperation in research and innovation. So that, I think, is critical. Secondly, I think we must build, as we've begun to do, capacity in different parts of the world so that when a crisis occurs, we don't have parts of the world able to respond and the rest unresponsive. Thirdly, South Africa, with its limited means, has decided to make some vaccines available to the poorest African countries. Due to inadequate budgetary means, we're unable to match what many countries, rich countries, have been able to do in donating vaccines. And I should be upfront and admit that. We have had very good donations by the United States. There has been a commitment to the COVAX facility, although not enough, but certainly a commitment to that. We in South Africa, through my departments, we have an African Development Fund, are making over 2 million vaccines. It's totally inadequate, but it's within our ability. This morning, I was reading the amount we've had to set aside for that. In South African currency terms, it's over 200 million. So my final point would be that when there is an international health crisis of this kind, the pharmaceutical sector needs to look at its price levels, because at times, part of the barrier is the cost of the treatment. It is extremely expensive, even where the world is under terrible threat. I think when there's an emergency, we need to respond in a different way because there's a crisis, and you cannot hold to the same profit-making levels when you're faced by a very dire situation in which you need all the world to be able to prevent itself from becoming sick from this virus.
Thank you so much, Minister Pandor. That was an excellent presentation and very informative. I think we will debate some of these ideas with the panel that's about to join us. So thank you again for joining us. As a reminder,